after the UK became the first country in the world to licence a COVID-19 jab yesterday. We are all hoping that the beginning of the end might finally be in sight.
Well, the breakthrough came as a welcome relief for a lot of us, but none more so than the Deputy Chief Medical Officer, Jonathan Van Tam, who admits he got quite emotional. So we can speak to him now. Good morning to you. It's lovely to be able to speak to you today, especially about something so positive as this. It is an incredible achievement. The UK became the first country to approve a COVID-19 vaccine. And when you heard the news, how did you feel?
I got a little bit tearful, if I'm truthful with you, because, you know, I've been working on this since March. Before the Vaccine Task Force even came into being, it began with a series of phone conversations with Sir Patrick Vallance, who's the Government Chief Scientific Advisor. And we knew from the word go that it was going to be really important to get vaccines that were safe and effective as soon as we could. And so, you know, behind the scenes, there's been an absolute army of people in the companies and in government working to try and bring vaccines to the UK. So it was a real watershed moment to see it finally approved and authorised for supply. And you know, hopefully it's the beginning of turning a corner.
Yeah.
I watched you on the news on ITV last night, and there were some people who were quite sceptical about it, and you managed to put their minds at rest. The caveat to this question is that I will be there as soon as it's my turn with my sleeve rolled up and my arm out, and I am absolutely ready, and I have no concerns and I have no worries. But a lot of people do. So I suppose the principal question is, if it normally takes 10 years to roll out a vaccine, to invent a vaccine, how is it possible that it's been done in 10 months?
Right. So there's lots of kind of ways of answering that, and they're all part of the answer. The first is that vaccine technology and the technological approaches to making vaccines are getting better and better. And I don't think we could have done it in this time frame if we went back to, for example, the 2009 pandemic and we had a new virus about which we knew very little. I don't think we could have done it in 2009, but we're in a very different place today because of the technology. The next thing is, it was very clear that it was a global public health emergency from the word go, and governments were prepared to put in lots of funding to manufacturers without any guarantee of success, but hoping that they would find a solution that was really important and game-changing. And on top of that, the manufacturers knew this had to be, you know, a straight run through. They didn't have time for investment decisions and pausing, thinking, is there a commercial market at the end of it? It just had to happen with real urgency. But in terms of the actual trials themselves, they've been just the same as normal vaccine trials. Phase 1, phase 2, and phase 3. Where time has been saved is, first of all, by recruiting participants, and big thanks to the participants. You know, this doesn't happen without participants, but they've recruited them in advance, so that actually, at the moment you've got your study protocol, you've got your ethics committee in place, you don't then say, well, would you take part in the trial? You've actually got this list of people already who've said, yes, get in contact with me and I'm ready to help. And that happened at phase 1, phase 2, and phase 3. And therefore, things ran very fast.
That's incredible.
The other thing it is. And the other thing to say is that you can't, unfortunately, it's an unfortunate fact that you can't tell if a vaccine works unless you're able to do a trial where you give half of the people the vaccine and half of the people either a completely unrelated vaccine or a dummy, a placebo. And what you then do is you follow them over time and you see how many cases, in this case of coronavirus, of disease, are occurring in the two arms of the trial. And if a vaccine's effective, you get little or very no disease in the vaccine arm, and you get a lot more in the placebo arm. But you can't make those diseases happen faster. You have to kind of wait for them to happen, wait for people to become infected. But with coronavirus, of course, it's been a global public health emergency. It's a highly infectious virus, and therefore the case numbers have just built up and up and up really, really fast. So you've got to very large numbers in these trials, 40,000 in most of them, very, very quickly. And if you have to happen quickly, you get a quick readout.
What do you say to the people who are the conspiracy theorists, the anti-vaxxers, who say this is all part of a massive Russian plot? There's a microchip in there. They could be controlling us. It's got something to do with Bill Gates. All of these things that you look at and think, it's so extraordinary that people would believe this nonsense. But what do you say as a scientist?
Well, you're right, Philip. It's extraordinary nonsense, and I don't give it any credence, and I don't give it any airtime. So I think your attitude's right.
I wanted to ask you, because in the press conference last night, it appeared that you had a little bit of a disagreement with Boris, and I think people will want to know when life will get back to some sort of normality. So, for example, once this vaccination rolls through, when can we expect social distancing and wearing a mask to become things of the past?
Yeah. So it may well have come across that we had a bit of a disagreement. In actual fact, I think Boris got it right, and I don't think I explained myself properly.
That's very gracious of you.
That's. Let me be absolutely. I'm always absolutely straight about things. I don't think I explained it properly.
Well, Jonathan, we'll just go through what you said. You said, do I think there will come a big moment when we have a massive party, throw our masks and hand sanitizer and say, that's it, it's behind us, like the end of the war? No, I don't. Whereas the Prime Minister said, and maybe on the other hand, we may want to get back to life as pretty much as close to normal.
Yeah, and we do want to get back to life as close to normal, and I hope we do, but I think we have to take it step by step. I think it will be gradual, and the point I'm making is that things like hand sanitisation, washing your hands or using a hand sanitizer, have for a very long while been part of our winter campaign about flu of catch it, bin it, kill it, and maybe, as a society, we haven't taken the spread of respiratory viruses seriously enough until this came along. And maybe habits rather than rules, such as, washing your hands very frequently when you've been on the tube and so forth, maybe they'll stay for some time. And maybe, as in the Far East, some people will choose in certain circumstances, because they've got used to it, to wearing face coverings. That's the point I'm making. Not that there are going to be rules about face coverings forever and a day. I really hope not. But maybe people will just adopt different
out of choice rather than it being mandatory. What about other vaccines? Because, it's not just this one. Obviously, there's the Oxford vaccine, which would be far easier to distribute. Because am I right in saying that the first batch of sort of 800,000 vaccines will come in batches of 975 and they cannot be split up? So that means logistically that's quite tough for people in care homes, for example, who need it the most to be able to get it there.
Yeah, you're absolutely right. At the moment, the first vaccine comes in these deep frozen minimum batch sizes of 975, and it isn't deep frozen all the way. You then can thaw it, and it's stable at 2 to 8 degrees for 5 days. But there are rules about how often you can take it in and out the fridge, and that's why it's still, although it's got this 5 days at the end where it's normal fridge temperature, it's still quite difficult to administer. And, the NHS, the MHRA are working really hard right now to try and find a solution so that we can get this into care homes if we possibly can. But there is no firm, at this point, there is no absolute assurance of that, because one thing we can't do is, end up with a vaccine that's been handled incorrectly and then isn't properly viable at the end of the distribution chain.
How long before
limits?
How long before the Oxford vaccine, which looks like it's much easier to handle, it's easier to distribute, it seems a little more stable. So how long before we can use that?
So the Oxford vaccine, as you say, is pretty much normal fridge temperature all the way through, and it is much more flexible in terms of small volumes and where you can get it to, and the number of different kind of NHS endpoints and NHS frontline endpoints where people can give it. We don't know how long that one is going to be, and it's kind of good that we don't know how long, because then it's not in our control, it's in the independent regulator's control. But we have had the headline readout a couple of weeks ago about the Oxford AZ vaccine, the fact that it's highly effective and is looking good. But that's not for me to decide, thankfully. It's for the MHRA and then the Commission on Human Medicines to decide. And we just want to let them take the time to do a proper, thorough job.
Okay.
What do you say to that? Is a sizable proportion of the people watching now who will be concerned about this vaccine, where many of us, the other side of the coin, are thrilled and excited and can't believe that this could be, a little bit down the road, that life could get back to normal. It can't get back to normal, if you don't have the vaccination, I'm assuming. And so, what do you say to those people who are worried?
What I can say to people who are worried is that I completely understand, and it's a potentially quite natural feeling for some people, but the polls tell us that 70% of people are in the same camp as you and I, Philip, that we are enthusiastic and keen and willing to have the vaccine when it arrives. But I can tell you that absolutely no corners have been cut by the MHRA in their assessment of this vaccine. And we've completely left them alone to do all the same assurance steps at their own time, just as normal.
Thank you. Thank you very much for joining us today. We've got Dr. Sara here now. So as far as you're concerned, as a GP in your surgery, have you been contacted yet? Have you had it explained to you how this will be administered?
So I know my GP practice hasn't been contacted directly, but I have got colleagues whose practices are now becoming vaccine sites. So they have been contacted and they've been told that they'll be given 10 days, warning that they'll be getting the vaccination. So steps are in progress, but
Amazing.
As far as I'm aware, it will initially be taken out in hospital hubs rather than in GP practices to start with, because as Jonathan Van Tam said, it's a complex vaccine. It requires, a lot of stages to get to the point from distribution to actual vaccination.
He said he got quite emotional yesterday when he could make that announcement, and who wouldn't? I was watching Tom Bradby on the ITV News last night. Was positively, sort of pulling party poppers. He was so excited. We are all, some of us, are extremely happy about this, because it could be a return to what we used to have. What about you as a GP? What did you think yesterday when you saw that?
Well, definitely, I'm as elated. I think it's so important because I see the fear, we see it in patients every day. We hear from them about their anxieties that COVID has brought about, not only through the horrible, tragic deaths, but also in terms of the mental health aspect of things. So I think it's so important that this is the next step, and it's an emotional point, absolutely.
Well, let's just hope it continues and that everybody gets it as soon as possible. Thank you. Thank you very much. Thanks for your time.
Thanks.